We're now in the century of the city. The 19th century was about empires. The 20th century about nation-states. But now we're in the century of the city. The United Nations has proclaimed 2010 as the year of urban health.
The New York Academy of Medicine has been advancing the health of people in cities since 1847. An independent organization, Nyam addresses the health challenges facing the world's urban populations through interdisciplinary approaches to policy leadership, education, community engagement, and innovative research. We draw on the expertise of our diverse partners worldwide and the more than 2,000 elected fellows from across the professions. Our current priorities are healthy aging, prevention, and eliminating disparities. One obvious advantage of the cities is that they are really magnets for culture, for business, for education. The sort of economies of scale, if you will, of setting up practically any service or enterprise in cities is going to lead people to look there first. The downside, of course, is the density that then develops. They become magnets for individuals looking for opportunities, and then you end up with people living here who are marginalized, and the disparities really are more dramatic in cities than they are in rural areas.
To address health disparities, Nyam conducts research to identify and understand health disparities, we design effective interventions, and we advocate for policy change to bring our work to a broader population.
The real focus for our work are the broader determinants of health that really give people the opportunities to act on the information they have about what choices can make them healthy or not. For example, the availability of healthy foods in a community, the ability to exercise, the ability to get transportation that doesn't pollute the air, safe streets, safe housing, and the kinds of communities that really support inclusion and active engagement. All of this comes together at the community level. In a sense, place becomes a very real determinant of the opportunities that people have to be healthy or not.
We're building raised beds.
And we're gardening.
We're digging plants, and we're
holes for the plants and
compost and a lot of stuff here.
And we're even taking out weeds.
And this is the very first tree that I have ever planted, and I'm very proud of myself.
I think if we're really going to understand disparities, we have to really dive below the averages. If you look at the average indicators of almost anything in a city, it'll come out sort of in the middle. But what you miss is the big gaps between the very rich, the very poor, those that have access to the services that are uniquely available in cities and those that don't.
A lot of the activities that we do here at the Academy are related to our surrounding community, East and Central Harlem. And one of the biggest issues has been the HIV epidemic. And the team here at the New York Academy of Medicine has done outreach for learning prevalence, risk factors for HIV infection, for doing behavioral interventions to try to change behavior, to do policy interventions.
Harlem is the epicenter of the epidemic. Nyam is making a difference.
Through our research, we have found that people are not hard to reach, people are easy to miss. Hard to reach implies that there's something about the individual that makes them hard to reach. Easy to miss is more of a systems perspective, meaning that there's something about the system that makes us miss individuals. So as a result of that, we walk out into the community, leave our buildings, interact with people at the community level, and then connect them to services.
That flyer, it has a specific number, it's in red.
Our work doesn't stop at the city limits. We're involved on a national and an international level.
The International Society for Urban Health was founded in 2003. It was founded here at the New York Academy of Medicine as a network of scientists, researchers, public health practitioners, people from other disciplines, community members and government leaders to talk about the issues facing cities and the impact cities had on the health of the residents. And each year we've had a conference where we've brought together people from around the world
Last year, the International Conference on Urban Health was in Nairobi, and this was a very exciting conference. We visited some of the informal settlements in Nairobi, especially Kibera.
Kenya's capital city typifies the current urban population boom and associated urban health and poverty problems. Its population has increased from 120,000 in 1948 to more than 33 million today.
We must harness a new generation of ideas and innovation. The 21st century is the century of the city. We have much work to do and no time to lose.
We invite you to become a partner in this work so that everyone living in cities has the same opportunity to have a safe, prosperous, and healthy life.